this is Brandon. I want to talk about metrics for success today. And those metrics are the way a patient grades you, not the way that we need to talk to insurance companies, not the way that we talk to each other. The way patients perceive you is if you're meeting their goals, and let's face it, most of that's based on pain relief. Are they getting pain relief? And as you know, and as I know, especially with radicular symptoms, that pain relief isn't always linear. It's not always starting here and dropping to here in a straight line. We see that gonna go up and down and up and down based on their activities, based on time of day, based on what they did last night. So we have to have other ways to grade that patient. And we have to set up our patient education in the same format. So here's what I do with patients with radicular symptoms is I tell them about the process of centralization. And as it turns out from literature, this is a great way to educate your patients, and it's also a great way to grade your patients if they're on the right pathway. If you have a patient and they're having radicular symptoms going down the leg, and let's just say it's at their calf, if you're performing some kind of active and passive procedures in your office and those symptoms are starting to come up into the thigh, up into the buttock, up into the back after your procedure, after manipulation, after directional preference, after exercise, after whatever it is that you do, you're on the right track. They come in the next visit, they've been doing whatever you said they're supposed to do, and it's still coming up the leg and closer to the spine, you're on the right track. Even though their back pain may not be making the same improvements, the process of centralization is a great way to measure success. That's very important to set your patient up from the very beginning, letting them know what to expect, because the exact opposite is also true. That if you're performing any kind of treatment, active or passive, and you're seeing that patient have pain that's now going down the leg, now it's going down into the foot, and the worst is when they come in and they say, oh, the pain's shooting down to the toes now, I'm just kind of waiting for it to go out, the toes and gone. And I'm thinking it's not a good thing that that's actually going in the peripheral direction. So make sure from the very beginning you educate your patients on the process of centralization. Take a look at this blog, take a look at the other blog that's linked in the side of this, this verbiage to make sure that you understand the process of centralization and peripheralization. And then also we touch upon the difference between chemical pain and mechanical pain. I hope this helps. Look forward to talking to you next week.